Hello there. My name's Dr. Bryoni. What's your name? Wonderful. Please come on in. Make yourself as comfortable as you can. Alright. Now, how may I help you? Mm-hmm. Mm-hmm. Right, okay. And have you had any other symptoms or experienced anything else that I may need to know about? Okay. Your symptoms seem to be quite generic. There are numerous reasons why you may feel dizzy, have headaches. It could be a wide range of different things. I am going to do a few different tests on you today, if that's alright. Wonderful. Well, please just sit back, relax for me. Okay. Alright. So I'm just going to check your temperature first of all. This is one of the most obvious reasons. I'm just going to pop this up against your head. Okay, I'm just going to try that again. Your temperature is 36.6, so that's not the issue. Your temperature's fine. You don't have a temperature. What I am going to do, I'm just going to get you to pop your finger in here for me. Okay, this is an oxygen saturation meter. It will just tell me what your oxygen levels are. Okay, so pop your finger in there. Perfect. And just take a nice deep breath in for me. Good. Oh, that's at 100%. Well done. It says here your heart rate is 81, but I will check that manually, okay? Perfect. Take your finger out. Lovely. Alright. I'm just going to check your pulse, so I just need your wrist. Hopefully you've got a nice, strong pulse. Okay, I got 42, but I only did it for 30 seconds, so I would times that, and it was about 84. Now, your pulse felt regular. I didn't feel anything abnormal, so I can just assume it's 84, which is kind of aligned with the oxygen saturation meter, okay? Alright. Next up, I'm going to have a little look into your eyes, if that's okay. Now, I do have a light here. It is quite bright, so please tell me if it's too much for you, but do not look directly into it, okay? Just look somewhere over here. Alright. That's it, do not look at the light. That's it, keep looking over here. Okay, now look over this side for me. Could you just look up with your eyes only? Look down. Now look left and look right. Okay. Alright. You've got good pupil response. I am going to just use this brighter light. Could you just look at the light? Look at the light. 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 Okay, now follow the light for me, okay? I'm gonna move it. Just keep following it with your eyes. Wonderful, you're doing really, really well. Okay, your eyes look fine. I have an eye chart here. Would you mind reading it for me? From here. E, good. L, T, good. How about this one? H, very good. This one? Wonderful. Can you do this one for me? Very good. Okay, that's all I need you to do. You've passed on that one. Okay. Now I have one here which is numbers. What's this number? 9. This one? 5. Good. What's this number? 8. 7. 4. Good. Can you read this number? 2. 8. 4. 3. Very good. Well done. Okay, your eyes are generally okay. Just tell me when you can see my fingers, okay? Good. Good. Okay. Tell me when you can't see them, alright? Good. Good. Perfect. Well done. Okay. How many fingers am I holding up? How many? How many fingers? How many? How many? How many? How many? How many? Perfect. Alright. I'm just going to use this light. Open your mouth for me. Just want to check that your mouth is okay. And stick your tongue out. Alright. Could you just say ah for me? Ah, very good. Looks okay. It's not red or anything. I'm gonna get you to try a bit of this. Just taste it. Tell me what it tastes like, okay? Ready? Pop your tongue out. Drop. Drop. Just. What does that taste like to you? Good. Okay. Now I'm going to have a little look into your nose. If you just lift your head slightly. Don't look at the light. I'm just having a little look into your nose. Okay. Now just do this for me. Alright, your nose looks fine. Could you now smell this one for me? What does it smell like? Good. You're really good at that. Okay. Next, I'm just going to check your muscles and everything, okay? So yeah, I'm just going to have a little feel around. Alright, I'm just going to start with your head. Just feel, let me know if you've got any pain or discomfort, okay? Okay, I'm just going to feel your shoulders. Okay, now your arm. Okay, and the other side. That's fine. I'm just going to feel your chest, okay? Come a bit of pressure on that. Any chest pain? Okay. I'm just going to come down and feel your tummy, okay? I'm just going to put some pressure on your tummy. Okay, just do a cough. Okay. That feels fine. Just move your head for me from side to side and up and down. Very good. Do a big smile and a frown. Can you wink? Good, okay. Now do a big smile and clench your teeth. Good, and stick your tongue out and move it from side to side. Perfect, that's all great. Okay, I'm going to have a little look into your ear. Alright, just want to make sure that everything's fine. Just turn your head slightly. Okay, I'm going to check the other side. Okay, your ears generally look fine. Just a little bit of wax in there, but nothing I'm concerned about. Okay, how is your hearing generally? Good? Alright. Yeah, I'm not concerned about that, no. What I am going to check now is your breathing. Okay. Could you now just take a deep breath in with me? Ready? And out. Good. Deep breath in. And out. Wonderful. Okay. I am going to have a little listen to your chest, alright? Okay. Just breathe normally for me. Okay, that's fine. I'm just going to pop it here. That's fine. I'm just going to come around and pop it on your back. And that's fine. Okay, I'm going to pop it here on your front. And just take a nice deep breath in. And out. Very good. Take a nice deep breath in. And out. Wonderful. That's absolutely fine. Your breathing is fine. There's no problems there. That's everything I'm going to check today regarding your symptoms, your dizziness, having a headache. I do think it might be down to the heat. I think you do need to drink some more, okay? And have plenty of rest. If you get any other symptoms of any kind, if you feel like you're going to faint, or if you do faint, then please do come back. But for now, take some rest, drink plenty of water, okay? And look after yourself, especially in this heat. Like I said, if your symptoms get worse or they don't get any better, please do come back, alright? Okay. Well, take care. You know where I am. Bye-bye. Oh, hello there. Please come on in and make yourself comfortable. My name is Bryoni. How can I help you today? Okay. Well, you've come to the right place. So, have you been experiencing any symptoms like shortness of breath, any chest pain, any palpitations? How about dizziness? Alright, do you suffer from migraines? Okay. And how do you feel when you're sitting down for a long time and then you stand up quickly? Do you ever feel dizzy, lightheaded, wobbly? How do you feel usually? Okay. Alright. Well, it could be cardiac related, so what I'm going to do, I'm just going to check a couple of things just to see how you are. Alright? Wonderful. So, to begin with, just take a nice deep breath in for me. Good. Out. Very good. Take a nice deep breath in. Out. Wonderful. I'm just observing you while you do that. If you can do it again for me, so a nice deep breath in. Out. Perfect. Alright. Well, now I would like you to do that, but hold it. Okay? So take a nice deep breath in. Hold. Let it out. Perfect. How did that make you feel? How does your chest feel? Okay. And how does your head feel? Alright. Could you now just take a nice deep breath in for me? Hold. And let it out. Wonderful. Okay. I'm just going to have a little listen of your chest. Okay. I've got my stethoscope here. Okay. I'm just going to pop this one on you. Just that. Just breathe normally for me, please. Okay. Still breathe normally. Good. I'm just going to pop this around your back, okay? Okay, good. Well, generally sounds okay, alright. Now I am going to get you to do a couple of things while I have a listen, okay? Wonderful. So, just breathe normally for me. Okay. Keep breathing normally. Okay, now take a nice deep breath in. And out. Take a nice deep breath in and out. Perfect. Okay. Now I would like you to hold it for a little bit, okay? So, take a nice deep breath in. Hold and out. Wonderful. And we're going to do that again. Take a nice deep breath in. Hold and out. Very good. Please just breathe normally for me. Okay. Alright. Could you now just sort of pant like a dog, a bit like that. Ready? Pant like a dog. Okay, stop. And breathe normally. Okay. Keep breathing normally. Okay, pant like a dog. Very good, you can stop. Alright, could you just do a cough for me? Just a little one. Just want to clear. That's it. Clear your chest. Wonderful. And just breathe normally. Okay. All of that sounds absolutely fine. I'm not concerned at all regarding your breathing. Everything appears to be quite clear and you responded really well. What I am going to do, I'm just going to have a feel of your chest, okay? Just tell me if you have any pain or discomfort, alright? Any pain or discomfort? Okay. Now I'm just going to touch your tummy. I'm just going to push a little bit of pressure on that. Okay. Any pain or discomfort? Alright. Just do another cough for me. Okay. Now pant like a dog. I just want to see what your body does. Wonderful. Thank you. Okay. So, I'm just going to check your temperature. This could be a factor for headaches, and you might just be quite hot, so I just want to check that you haven't got a temperature, okay? Perfect. Your temperature is 36.2, so that's okay. You're actually on the colder side. That's alright. Now I'm just going to check your oxygen saturation levels, alright? So I have this oximeter, and I'd like you to pop your finger in there, and it's going to tell me your oxygen saturation levels, okay? So pop your finger in. Perfect. Now, yours should be between 96% to 100%, okay? Just take a nice deep breath in for me. Good. You can take some time to register. Wonderful, it's 99%. Perfect. Now it actually says your heart rate is 86. I am going to check your pulse, if that's okay. I just want to make sure it's correct. So I just need your wrist. Is that okay? Perfect. Just going to have a little feel. Make sure I can feel your pulse. Oh, perfect. You've got a very strong pulse. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21. I got 83, so that's absolutely fine. And I expect them to be slightly different, but I've checked you and your pulse is very good. So next I am going to check your blood pressure, if that's okay. Perfect. So I am going to check it manually. Alright. So I need you to pop your arm in here, and I have this little gauge here, and I will be pumping it up. Okay. So if at any point you find it too tight for any reason, please let me know. Okay. So what I need you to do, I need you just to slide your arm in here. Very good, that's it, pop your arm in. Wonderful. Is that secure? Lovely. Okay. Now I'm just going to clip this gauge on, just so I can read it while it's on your arm. Perfect. That's great. And just relax your arm down. Okay? Just down by your side. Wonderful. Okay. So, what I'm going to do, I'm just going to pop this in my ears. So, first of all, I'm just going to feel your pulse, okay? Okay, so I've got your pulse. I'm just going to pump this up, okay? Just need to get a rough idea how much I need to pump it up. Okay, ready? Okay. Alright. Okay. I'm just going to loosen that. Wonderful. Okay. I'm now going to use my stethoscope. I'm just going to place that there, just under your, that's it, just under the cuff slightly. That's it, right by your main artery. Perfect. Okay, so I'm just going to pump it back up. You're doing really well. Now I need to listen carefully, okay? Okay, I'm just going to slowly release. Okay. Perfect. Well, you have the perfect blood pressure, 120/80. So that's absolutely fine. Alright. Well, I've checked everything today that I want to check. Everything generally seems okay. What I would say is just keep an eye on your headaches and migraines. It is very warm at the moment, and you might perhaps need to drink a little bit more, keep yourself hydrated, okay? Now if you do develop any sort of cardiac symptoms, palpitations, dizziness, chest pain, shortness of breath, that kind of thing, please do come back to see me, alright? Wonderful. Well, take care. Bye-bye. Oh, hello there. Please come on in. Take a seat just there for me. My name is Bryoni. Could you just confirm your full name for me, please? Perfect. Wonderful. So I understand you're here for your yearly flu vaccine, is that correct? Wonderful. Alright, just confirm your date of birth for me. Lovely. So have you had the flu vaccine before? Okay, so the flu vaccine actually protects you against the flu, okay? Now the flu is a serious life-threatening illness, okay? And the vaccine just prevents you from getting the flu, but also managing the symptoms of the flu, okay? Alright. I don't want you to worry, you seem a little bit anxious. Is it the injection that you're worried about? Alright. Well, I have done a lot of these, so I want to kind of reassure you that you're in safe hands, okay? I know exactly what I'm doing, alright? And when we get to that part, you can look away and it will honestly be over within about 5 seconds, okay? Alright. Now I do just need to ask you some questions, okay? So, I'm just going to pop today's date for the vaccine. Okay. Are you completely well today? You're not sick, you don't have any flu-like symptoms, you don't have COVID? Okay. Have you had any adverse reactions, or do you have any allergies regarding vaccines or any allergies in general? Okay. Alright. Do you have any illnesses which may affect your immune system? Okay. Alright, let's just finish everything here. Okay. Alright. Have you ever felt dizzy, nauseous, or have you ever fainted while having any sort of vaccines or injections or anything previously? Okay. And is this because, you're anxious? Okay. Alright. Okay. Alright. Well, that's everything I need to do on my side, okay? I'm going to check a few things. I just want to make sure you don't have a fever or anything at the moment. I'll check that you haven't got a temperature. I just want to check a few things, and then I will give you the vaccine, okay? Wonderful. So I'm just going to check your temperature. Just look straight at me. Okay, it's 36.4. It's absolutely fine. And could you just pop your finger in here? I want to just check your oxygen saturation levels, okay? Just put that in there. That's it. It does take a few seconds to register. Just take a nice deep breath in. And out. Good. One more deep breath in. Out. Wonderful. So your oxygen saturation levels are actually 97%, and your heart rate is about 85. that's not that bad. That's good. Yes. So that's all done. Okay. I'm just quickly going to feel your pulse. I just want to check it manually. Okay. So if you just pass me your wrist. Hopefully you got a nice strong one. Lovely. Okay. 2, 3, 4, 5, 6, 7, 8, 9. Okay, I got about 82. That's absolutely fine. Okay, now I am just going to get everything prepared. Okay, please just compose yourself. I'm going to give you a couple of minutes while I get everything sorted. Alright? Try not to worry, okay? You're safe here with me. Just going to put some gloves on. Alright, I'm now just going to prepare the injection, okay? Okay. Now I know this looks pretty daunting, pretty scary, okay? But you're going to be alright. Take a deep breath in for me. Very good. Deep breath in. Okay. Please turn a little bit that way. You don't want to see. Okay. I'm just going to grab just the top of your arm here. Okay. Just to make sure I get the muscle. Lovely. Okay. Do you want me to tell you when I'm going in? Okay. Okay. Alright. Take a deep breath in. Now. Good. Good, 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 good. A little bit painful. That's it. Just a sharp scratch. Well done. Breathe out. Breathe normally. Okay. I'm just popping it in now. Just count to 5. 1, 2, Good, okay. I'm now just going to pull it back. Alright, breathe in. Good, and breathe out. Well done. I'm just going to get rid of that in the shaft box. Let's have a little look at this. That's fine. I'm just going to pop a little bit of tissue on there. I'm just going to hold it. It's only tiny, you're not bleeding or anything. I'm just going to wait for that to stop. Perfect, I'll just leave that on there. It should stay. Lovely. Alright, I'm just going to take these off. How are you feeling? I just want to observe you for a minute or so. You did really, really well. I told you it wouldn't be painful. Usually when the needle goes in, it's always good to take a deep breath in, let it go in, and then just breathe normally, okay? It's just a little bit of advice. So I'm just going to... Wow. I'm just going to recheck your temperature. That's still the same. And how are you feeling? Any dizziness, lightheadedness? Any migraine? Do you feel a bit faint? Alright. You've done actually really, really well. What I would say, you are free to leave now because you're completely fine. If you would like to go back into the waiting area, there is a water dispenser there, so you can have a glass of water. And maybe just on your way home, just have something to eat, okay? And drink, keep yourself hydrated. Now you can get a little bit of sort of bruising, a little bit of pain, just where it's going to be quite tender, only for a day or so. You can take some paracetamol as soon as you get home, and you might feel a little bit tired. That's completely normal, okay? But if it goes red or quite sort of inflamed or anything, you need to get back in touch with us, okay? Good. Alright. Well, thank you so much. Honestly, you were fine. Alright. Well, take care. Bye-bye. Bye-bye. Okay. It's all done. My next vaccination in a couple of minutes. Oh, hello there. My name's Bryoni. What's your name? Oh, yes. How have you been? Okay. And what symptoms have you been feeling? Right. Okay. So you've been having headaches? Any migraines? These tend to be a lot more painful and last for longer durations. You can also feel nauseous. Have you been feeling any other way? Is it mainly just the pain? Right, okay. Is there anything else you think I should know about that may factor into why you're feeling like this? Okay. Alright, well, don't worry. I think I can make you feel better. What I would like you to do is just make yourself as comfortable as you can, okay? Now, I am going to be doing an examination, okay? Just a few things I want to check, make sure you're okay. I will do a little bit of a test with your eyes, but not too much, okay? If at any point your headache gets worse or you get more pain, just tell me and I will stop, okay? There's a few things I want to rule out, a couple of things which I think it's important to check, alright? But at any point at all, if you need me to stop or slow down, just say, alright? Wonderful. Okay. So I'm just going to pop some gloves on. Alright. Now, I'm just going to have a little feel around, okay? Please tell me if you have any pain or discomfort. I will pop a tiny bit of pressure just on your head like this. Just tell me if any particular parts are more sensitive or more painful, okay? Alright. How does this feel? Any changes to your pain? Any discomfort? Alright. Okay, well done. I'm going to just check your temperature. I want to make sure you've got nothing else sort of going on, just so we can get to the root cause, okay? So, just going to pop this here. Just going to come a bit closer. Temperature is 36.4. That's okay. It's not your temperature. I don't think you have a temperature. What I'm going to do, I'm just going to get you to pop your finger in here for me. Okay. This is an oxygen saturation meter, and it just tells me that you've got enough oxygen. So I need you to pop your finger in here like that. Okay. It's very clever. Just clip that in for me. Wonderful. Now it can take a few seconds just to register. Just take a nice deep breath in and out. Good. Take a nice deep breath in and out. Can you do one more? Deep breath in oxygen saturation is 97%. Gonna take that one off. Now I do just want to check your pulse. So I just need your wrist. I'm just gonna feel here, okay? Hopefully you've got a nice strong pulse. Lovely. 1, 2, Okay, it's about 76. Your heart rate is fine. Alright. How are you feeling? Alright. Is everything okay so far? It's not getting worse. Okay, good. Alright. So next up, I want to just check your blood pressure. Okay? I want to make sure that it's not low or high. This could also have a factor. I'm going to get my stethoscope just here. Okay, so I'm going to check it manually. Alright, it's a lot more accurate that way. Good. Okay, so if you can, I need you to pop your arm in here for me. Okay, I'm just going to open it up. Just slide your arm in. Okay, just going to push that up, tighten it a bit. Wonderful. Okay, so I'm now going to be pumping it up. Alright? Now, first of all, I'm just going to feel for your pulse, just so I know how much to do it up by. So I'm just going to take your arm. Lovely. Okay. I'm going to pump this, okay? Lovely. Okay. I'm just going to deflate that. Wonderful. Alright. I'm now going to pop this on. I'm just going to pop this up through the cuff a little bit. Just on your main artery there, so I can hear that. Wonderful. Okay, now I am going to pump again, and this will tell me your blood pressure, okay? Lovely, you're doing really well. Perfect. Let's pop this down. I'm going to take this off. And we're just going to take that one off your arm. Just slide your arm out. Wonderful. Your blood pressure is actually 111 over 74. Slightly on the lower side, but I'm not concerned with that at all. It's only just slightly low. Okay. You probably might need some more. Have some fluid, some water, maybe something to eat. Okay. So after this, it's really important to have perhaps a glass of water. All right. And that might just take the edge off for you. You might be a little bit dehydrated. Okay. Alright, what I am going to do now, I'm going to check your breathing. Okay, so I would like you to take a nice deep breath in for me. Out. Good. Take a nice deep breath in. Out. Okay. Nice deep breath in. Out. Alright, well done. I'm just going to have a little listen. I am going to pop this one just here. Please breathe normally. And then just here, breathe normally. Okay, now if you can, take a nice deep breath in. Out. Nice deep breath in. Out. Okay, I'm just going to move this. Breathe normally. Take a deep breath in. Out. Wonderful. Your breathing is fine. It's clear. You're not congested or anything. That part is generally okay. Do you suffer with a cough or asthma? No, just your head. Okay. And how is your head right now? How is it feeling? Alright. Okay, well what I am going to do, I am going to check your eyes just a little bit, okay? I don't want to put too much pressure on them. It's usually a main cause for headaches or migraines. I think what I will do is request for you to have a thorough eye check. You may just need some new glasses, okay? But just to make sure that nothing's going on. But what I would like you to do is just look here, look here, look here, look here, and look here. Good. Tell me when you can see my fingers. Good. 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 Well done. Good. Perfect. Now tell me when you can't see them, okay? Good. 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 Okay, now I would like you to look at my finger. Follow it with your eyes. Follow my finger. Tell me if your headache gets worse. Okay, follow this finger. You're doing so super well. Well done. Perfect. Okay. What I'd like you to do now is just read this eye chart. Okay? Tell me what this one is. Good. 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 I can see you struggling a little bit there, aren't you? Okay. I am going to try something. I do have a couple of lenses here. I do think you need a thorough check though, but I just want to see if this is going to make any difference to your vision, okay? Or if this reduces the strain on your eyes. How's this? Is this better or worse? Okay, what about this one? Better or worse? Okay. This one? Better or worse? And this one? Better or worse? Okay, interesting. I've got one more here. Okay, tell me, is this better or worse? Right. Worse? Okay. Okay, are you ready? Better or worse? Okay. Better or worse? Okay. Those are the only ones I have. I am going to refer for you to get a thorough eye test. Okay. I'm also going to request for you to have a set of routine bloods done. Alright? But for the meantime, I'm going to do a couple of remedies just to try and ease that pain for you now, okay? The first one is, I want you to smell this for me. Now this is supposed to help with headaches and migraines. It's supposed to ease that for you, alright? Okay, just give this a smell. Make sure you get a good whiff. Good. One more. Good. Okay. Hopefully that takes the edge off a little bit, clears everything. Okay. Next up, going to use this. Okay? It's just going to be some relaxing sounds just to try and ease that pain. Okay? Just close your eyes if you prefer. Really well. Perfect. Okay. Just got a cold compress here. Just going to pop this on your head, okay? Hopefully this just releases some of that pressure. Alright, so what I am going to do, I'm going to request for you to have a thorough eye test done, a routine set of bloods, okay? Now what I would like you to do is keep your fluids up, drink plenty of water, okay? And if it's still bad, come back to see me, alright? Okay. I'll take care. Bye-bye. 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 Oh, hello there. Please come on in and make yourself comfortable. My name is Dr. Bryoni. That's it. You're right on time. So can you tell me a little bit about what's been going on? Why you made this appointment? Right. Okay. And what symptoms have been occurring? Okay. Alright. Well, there are numerous reasons. Some simply could be dehydration, lack of sleep, that kind of thing. However, it can be more serious. I will do a few tests today of what I can do, and then I'll evaluate and see whatever things we can do. Okay? Perfect. Alright. I'm just going to pop some gloves on. I'm just going to pop these gloves on just because I will be coming a little bit closer to you and I am going to touch you. Okay? if I just come a bit closer and just feel around your face and your head, just around your ears and your jaw. Is that alright? Wonderful. Please do let me know if you have any pain or discomfort. Alright, that generally feels okay. Now, I'm just going to feel your shoulders and your arms, okay? Just make sure everything's fine. Just do this arm. Any pain or discomfort in your arm there? Alright, now the other side. Any pain or discomfort? No, perfect. Alright, I'm going to just touch your face, both sides at the same time. Let me know if there's any changes or if one side's more sensitive than the other. Okay? Okay, can you just puff your cheeks for me? Puff your cheeks, and now bring them in, and puff them. Okay, clench your teeth. Okay, can you just move your head from side to side and up and down? Wonderful. Any pain or discomfort? No? Alright. I'm now just going to use this tool. I'm going to touch your face with it. It should feel cold. If it doesn't, please let me know, okay? Touch. 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 Wonderful. Alright. Now I'm just going to check your temperature. So just look straight at me. 36.3. The temperature's fine. Okay? Alright. What I would like you to do, I want you just to smell this for me. Just give that a whiff. What does that smell like? Well done. That's perfect. Next, are you able to just read the side chart for me? Starting here. Good. Mhm. Mhm. Lovely. Slightly harder. Wonderful. And what colour is this? Rectangle. And what colour is this one? Perfect, good job. Okay, next up, just tell me how many fingers you can see. How many? How many fingers? How many? How many? How many? Good. How many? How many fingers? How many? Okay. Would you say they're close to you? Okay. How about this? Close or far from you? How about now? How about now? How about now? Close or far? Close or far? Close or far? Close or far? Wonderful, okay. Just look at my finger. Now follow my finger. Keep following my finger. Very good. Keep following my finger. Alright. I'm just going to use a light. Gonna have a little look into your eyes, okay? So just look over here for me. Good. Look at my hand. Do not look at the light. Okay. Do not look at the light. Look at my hand. Okay. Alright. Now look over this side. Do not look at the light. Look at my hand. Okay. Your eyes are fine. Could you just look up for me with your eyes only? Now look down. Look left. And look right. Okay. I'm going to use this light. Look at the light. Could you now follow the light? Just follow the light for me. Follow the light. Follow the light. Follow the light. Follow the light. Okay. Now, I'm going to check your memory. Okay. So what I would like you to do is just look at this chart, and I want you to remember as many as you can afterwards. I'm going to go through them, okay? Apple, flower, cat, bell, mug, cake, glasses, hand, rugby ball, a truck, whiteboard, sandwich, balloons, present, bird, magnifying glass, dog, pencil, 7, tree, flag, trumpet maybe, earth or the world, bicycle, and a book. So have a look at those. You can use your own terminology if you like. Have a little look. I'll give you 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. Now, what I'd like you to do, just tell me how many you can remember. So, say them all now. Good. 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 Oh, yep, good. Try and do one more for me. Alright, you did really well actually. A lot better than I thought you would. Alright, next I'm just going to check your blood pressure. Okay, so I've got a cuff here. Now, I do need you to pop your arm in for me. So, if you just slide your arm in that cuff there. Wonderful. Now, is that comfortable? It is. Okay. Then just relax your arm down. Okay. Perfect. So, I'm just going to hold your pulse on your wrist. I'm just going to pump it up just so I know how much to do it, okay? Feel for your pulse. operatives. Alright, I'm going to inflate the cuff. Okay, let's deflate that. It's about 160 for you. Okay, I'm now just going to pop this in. Alright, I'm just going to pop this under the cuff there. Lovely. Okay, so just sit nice and still, just looking at the gauge. Alright. Okay, I'm gonna pump it again. Lovely. Just gonna deflate. Perfect. Wonderful. That is absolutely perfect. Your blood pressure is 120/80. That's completely perfect. Let's just take your arm out of there for you. That's it, just slide your arm out. Lovely. Thank you. Okay, I'm now just going to check your oxygen saturation level. So just pop your finger in there for me. Wonderful. Keep your hand nice and still. Okay. Now, take a deep breath. Good. And out. Very good. Deep breath in. And out. Perfect. Alright, your oxygen saturation is 97% and your heart rate is 81. So that's absolutely perfect. Alright. Finally, I'm just going to have a little listen for your chest. I just want to make sure you're not congested. I want to make sure I can't hear any fluids or anything and that everything's nice, open and clear. Alright, so just sit back and relax for me. Just going to put this on your chest. Just that, breathe normally. Okay, just slow it down. Breathe normally, and just a bit lower. Breathe normally. Okay, I'm going to come around and pop this on your back, just turn slightly. Lovely. Good, I'm going to move that. Okay, and I'm going to move it again. Lovely. Okay, I'm just going to pop this here. Now take a deep breath in. Good. And out. Good. Take a deep breath in. Out. Wonderful. Breathe normally. Okay, now do a cough. Perfect. Okay. Well, everything sounds fine. It doesn't sound congested or anything. I'm generally quite happy with how everything has been today. Now, regarding your symptoms, like I say, I think it's more dehydration and lack of sleep. But I am going to request for you to have some routine bloods done. Okay? So you will receive a separate appointment for that from our phlebotomist. Okay? Lovely. Well, I don't want you to worry. You have nothing to worry about, to be honest. But I would like to just see your bloods, just to make sure they're okay. Yes. Alright. Well, take care for now. Alright, and we'll meet up soon. Bye-bye. Oh, hello there. Please come on in and make yourself comfortable. My name is Bryoni. I'm just putting on some gloves. So you're here for an eye test, is that correct? Wonderful. Now, have you been experiencing anything unusual? Anything out of the stationary? Anything I should be aware of? Okay. Alright, well, this just seems like a routine check. Perfect. Okay. Have you had any blurred vision, double vision, any watering in your eyes coming out, any redness? Right, okay. Alright. Is it okay if I just have a little feel of your eyes? Perfect. I'm just going to come closer. Just have a little feel of your eyes. If you have any pain or discomfort, please do let me know. Okay, feels fine around your eyes. It's not red. I don't see any lumps, no bumps or anything. What I am going to do, I'm just going to pop a little bit of saline just in your eyes, just to clean them. I am going to be doing a few tests, and I just don't want you to get dry eyes, okay? Alright. So I have this here, okay? This is some sterile eye wash, okay? And it's very good to put in your eyes before I do any sort of testing, especially with lights, okay? It helps not to dry your eyes out. Alright. So what I would like you to do is just tilt your head back slightly. Okay. Tilt your head back slightly. I'm just going to pop this in your eye. Okay, you ready? Alright. Alright. Just gonna pop this down. Okay, now just give your eyes a bit of a blink. Okay, that will dry, don't worry. Alright. What I'd like you to do first is just look it. Look it. Look it. Look it. Look it. Very good. Look it. 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 Wonderful. How many fingers do you see? How many? How many? How many? How many? How many fingers? follow my finger. Keep following my finger. Very good. Keep following my finger. Wonderful, keep following. Okay, now follow this finger. Keep following my finger. Good. Perfect. Tell me when you can see my fingers. Good. Good. Well done. Perfect. Alright. What I'm going to do now, I'm going to use a light. I'm going to look into your eyes. Just look over here for me. Okay. Look over here. Good. Don't look at the light. Okay. Alright. Look over this way. Okay. Got my hand. Okay. Okay. Could you just look up for me? Okay. Look down. Okay. Look left. And look right. Okay. Your eyes are responding well. Could you now just look at the light? Look at the light. 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 Okay, now just follow this light. Follow the light for me, please. Keep following the light. Okay. Okay, you can blink. How do your eyes feel? Okay? Alright. I've got a brighter light. Can you look at it for me? Okay. I now want you to follow it, okay? If your eyes start to hurt, you can stop following. Just try your best to follow the light. Keep following the light. Well done. Perfect. Well done. Okay. What I would like you to do now is just read this eye chart, okay? What's this? Good. 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 Wonderful. Good. Good try, well done. How about the last one? Okay. What colour is this? And what colour is this? Perfect. Okay. Your eyes do seem fine. Alright. Your vision seems okay as well. Okay, what I am going to do, just because you spend most of your day sort of looking at a screen, whether that be your computer, your phone, your TV. I think you might benefit from glasses with blue light. Just a reflection to help you with sort of screens, devices. It can also help you when you're going to bed if you're watching on your phone. You can just wear the glasses and just protects your eyes. It stops you from getting headaches or migraines, or at least aims to prevent that. What I am going to do, I'm just going to see if you will benefit from any prescribed lenses, okay? So, I've got a couple here. Now I'm just going to pop this here. How does that feel? Is your vision better or worse? Better or worse? I know it's a bit hard to tell. Okay, let's try it this way. Better or worse? Okay. Alright, let's try this one. It's not as strong. Okay. Ready? Better? Worse? Okay, try this one. Better or worse? Okay. Let's try this one. This one is just minimal. Okay. Ready? Is this better or worse? Okay. Better or worse? Is that good? Alright. Let's try this. Better or worse? Okay, I think this might be the one for you. So this is just 0.25. I think you will benefit from this plus a blue light reflection. So what I will do after this appointment, I will pop you in for a referral just for you to get some glasses with blue light and 0.5. Okay, just think it will enhance and help you. Alright, I next just want to check your colour blindness. So could you please just tell me what you see in this circle? What number do you see in here? 12. Good. What number do you see here? Good. How about this one? Good. What number do you see in here? Good. What do you see in this one? Good. And finally, how about this one? 5. Well done. Okay. Well, generally, you've done really well. Okay, that's all I'm going to check today. Your eyes have responded exactly how I wanted them to. Just a quick check, but I think you'll benefit from some blue light glasses. Alright. You are so welcome. Take care. And you should receive a letter in the post for you to get your glasses. Okay? Alright. Bye-bye.